presentation is actually a panel presentation. It is engaging persons with lived experience, successes, and challenges from the peer perspective. And this is a panel discussion that's being hosted by Ann Whitman and Cynthia Piltch.
Okay, you're good to go.
We okay to go? Hi, everybody. I'm Cynthia Piltch, and we are delighted to be here to present this panel. I am Cynthia Piltch, and I am here along with Ann Whitman. The two of us are moderating this panel, and we will be introducing the panelists and asking the panelists a series of questions. So with no further ado, I'd like to introduce the panelists that are from our two centers. First, introduce Valeria Chambers and Jacqueline Martinez from our center at MGH, and then D. Logan and Emily McCaffrey from iSPARC at UMass. And we're delighted to have all of them with us. And Ann and I will ask questions in succession. So we're gonna begin the panel by asking really the two presenters from MGH. I'm gonna begin with Valeria Chambers and ask her if she would be so kind as to describe the backgrounds of the peer-led team and the nature of the teamwork at MGH Center, and then discuss one peer-led project highlighting a success and a challenge of that. So Valeria, if you would be so kind as to begin the presentation, that would be great.
Thank you, Cynthia. We are a team of 7 of diverse backgrounds and expertise, with long-standing ties to several different cultural communities throughout the state. Among us, we have certified peer specialists, certified older adult peer specialists, recovery coaches, a forensic peer specialist, 2 artists, a Reiki master, as well as several folks with advanced degrees. All of us are parents except me. I'm a supportive aunt. We each have strong commitments to using community-based participatory research to connect with our peers, listening and learning through their experiences and input to make good on our motto, nothing about us without us. And this is throughout all phases of the research process, from the formulation of the research question to analysis, discussion, and dissemination. The inclusion of our perspectives makes for stronger and more relevant outcomes. We don't speak theory here, we speak experience, and this helps lead to more authentic responses from our peers. We have monthly peer consultant meetings with the MGH Center researchers and administration, bi-weekly project meetings with project coordinators, and we meet in smaller groups as needed, depending on the project activities that we're working on. All of our work is peer-led and mutually envisioned. Each peer consultant is encouraged to bring his or her unique gifts and interests to this work, and there are many opportunities to grow into. We are fortunate enough to have the guidance and mentorship of experienced researchers in mental health, and we are paid a professional wage. Because we work with a small research group, we have more autonomy than what would probably be possible in larger systems. The CARE project, that's C-A-I-R-E, stands for Cultural Access, Inclusivity, and Racial Equity. It was created with the goal of increasing the representation of BIPOC, that's Black, Indigenous, people of color, in peer support and mental health services, while making connections with these communities to find out what their needs and experiences are in their own journeys towards better health and balance. We have 6 recovery learning communities in the state, but there is little racial or cultural diversity. We'd like to find out the reasons for this. Currently, the CARE project has been invited by the Department of Mental Health and the Boston Medical Center with Southeast Recovery Learning Community, which is directed by my peer consultant colleague, Sandra Whitney Sarles, to hold listening groups and interviews with people with lived experience, providers, and community leaders, including racial, cultural, or occupational affinity groupings. We've connected 19 listening groups and 13 one-on-one interviews of community leaders from BIPOC, LGBTQ+ communities, and transition-age youth, conducted in either Portuguese, Spanish, or English. This project is still in the beginning phases, but thus far, one of the things that strikes me about what we've been observing is that different groups may have different ways of describing their experiences within their own cultural context. Speaking to people about their experiences using words and language that have meaning for them, rather than imposing our own constructs upon them, is an important step in developing more services and supports that are both attractive and more culturally relevant to those groups. A challenge has been the lack of participant follow-through with attendance and survey completion after having signed up. Reminder calls as well as emails may help this in the future. We've also heard that some people may not come to a peer support group per se, or an RLC, but they would be interested in meeting out in the community with, say, a certified peer specialist from their own cultural group. Finally, it's been a pleasure to discover that there are many community members and stakeholders from many different racial, ethnic, and cultural groups who would welcome becoming involved in activities to benefit themselves, their families, and their communities. Thank you.
You're on mute, Cynthia.
Cynthia, you're muted.
Why don't I step
Thank you
in?
so much. Thank you so much, Valeria, for that very informative description. And I'd like to follow that up with a parallel description by Jacqueline Martinez of her experience of one project that has taken place in our efforts, and both a plus and a challenge that has coincided with that.
Thank you, Cynthia. My favorite project is our parenting project. Our peer-led team facilitated 18 listening groups in numerous recovery learning communities with a total of 156 participants. Results from the listening groups on the importance of the whole person care led peer consultants to focus on helping parents in recovery. This team planned and produced a video of personal accounts of parents with lived experience of mental health and substance misuse challenges. The video was undertaken with the goals of reducing stigma around mental health and parenting, ending feelings of isolation for parents with lived experience, breaking negative cycles around parenting, such as emotional avoidance, internalized stigma, not reaching out for support, and ineffective styles of discipline. And finally, sharing resources to strengthen parenting and mental health. Interview questions were developed based on these goals. The parenting group consulted various experts for guidance on developing a video that could serve as a tool for providers and parents. The team reached out to parents in their own recovery networks and identified parents to participate in this video. Filming services were provided at no cost by Harvard Medical School. Since our plan is to use the video to train providers to ask about, access, and assist individuals under their care with parenting. After footage was compiled, the team reviewed each interview and together identified impactful themes and messages. Once the team members edited the video, edited versions were reviewed by team members and feedback subsequently editing conducted in the interactive process. Once the video was completed, the team began efforts to disseminate the video together with a facilitated discussion. My favorite part. That was guided for providers or parents. Designed to solicit reactions to the video and changes that video could foster in parenting and for providers in the practice for providing care. So a total of 15 presentations so far and over 2,000 views by peers, providers, and residents, psychiatry residents. The video was very well received. This film was much more authentic and powerful, being that it was peer-directed and led. So one of the challenges was going at a pace required by academic researchers. We really wanted to get this out there ASAP. We're so proud. And one success that I'm very happy to say is that this coming fall, we'll be presenting at the DBSA National Conference. We wanted to distribute the film before research questions were put in place. We did this and now created a research project around stigma reduction.
Thank you so much, Jackie, for that very cogent summary of a very ambitious project, another ambitious project. And clearly the opportunity for presentation and duplication of these projects is a great opportunity for the enhancement and extension of the projects over time. I'd like to turn it now to Ann Whitman, who will be presenting the questions to the iSPARC staff.
Hi, Dee. I'm wondering if you could describe how iSPARC incorporates stakeholders in the work that they do.
Yes. Hi, everyone. Thank you so much for joining us today. So iSPARC incorporates persons with lived experience, stakeholders in our work in a variety of ways. One of the first ways is that we have our stakeholder engagement program that you heard about a little bit earlier when Marianne Davis went over iSPARC as a center. It's co-led, as she said, by Melissa Anderson, Celine Larkin, and myself. And we do work with everyone in the center to help them if they have questions about stakeholder engagement, if they need consultation. We work closely with our two standing advisory boards, and we also do annual surveys of our participatory action research, the levels of engagement of stakeholders in our communities of focus. We review that and compare it, and sometimes offer consultation to some programs or projects that may be interested in it. Some of the other ways we incorporate stakeholder engagement is we have two standing advisory boards that have been part of iSPARC and part of our center for, that's called Transitions to Adulthood Center for Research. One of our boards is called the Youth Advisory Board or Young Adult Advisory Board, which you'll learn a little bit more from Emily in a little bit. But that is made up of young adults, roughly ages 18 to 30-ish, who have lived experience of a mental health condition. And then we also have our Family Advisory Board, which we like to call the FAB, which is persons who have family members who have lived experience of mental health conditions. So it could be a mom, it could be a dad, it could be a sibling, a grandmother, cousin. And we have these boards that are standing boards so that we can go to them with research questions, to have them assist with reading interviews that we're going to be conducting, looking at the questions, seeing if they are in the language of the community of focus. So, you know, if we're going to be talking to young adults, we want to get feedback on our surveys or other sorts of data collection tools to make sure that they're in a language that's friendly to young adults. And they sometimes help us with developing products. The co-development of products is really important with our center, having folks who have the experience and are the experts to create products that they think will be useful to the community. And then we also have what we call our deaf community advisors. Did I get that right, Melissa?
Yep.
And sorry. Those are folks that are hired specifically for Melissa or for Melissa Anderson's grants. There are persons with who are deaf who are hired and they're trained on a research project, and they're pretty much involved in all levels of the research project once they get on board, helping to analyze results, working with the community. So that's a really important way we incorporate stakeholder voice as well. And then we also hire persons with lived experience. Some of us here at iSPARC have decided to let folks know that they have mental health conditions and live with it. So they've disclosed that and offer their lived experience when looking at grant submissions or talking about how to do an interview or anything like that. So some of us can offer that sort of expertise. And then for individual grants, sometimes they hire advisory councils for that specific grant. So we have a smoking cessation study that we're doing, and they've created an advisory council that will be for the period of that grant, and then it'll be dissolved when that grant is finished. So we also have advisory councils that way as well. So we try to make sure that we have voice in a lot of different levels of the research. Folks help to do presentations at the end and getting the information back into the community. So thank you.
Thank you, Dee. I'm really impressed by the variety of ways that you involve stakeholders, from standing committees to hiring peers and staff positions to consultative projects and the deaf group. So it's a real broad variety in which you use stakeholders, and I think that's very impressive. I wanted to turn to Emily and ask her a question. Can you talk about how iSPARC includes the voices of young adults with lived experience in the work that they do?
Absolutely. Thank you so much, Anne. So my name is Emily McCaffrey, and I am a research coordinator here at UMass Medical School with the Transitions and iSPARC Center. It has been such an honor for me to be able to co-facilitate the Young Adult Advisory Board, which we call the YAB, and I have nicknamed them my Yabbies. I'm not sure if they like that name yet, but we're going to keep going with it until they tell me they don't like it. It's been absolutely incredible. Right now, we have 12 members from across the nation. So we have Idaho, Florida, New Mexico, California, a lot from California, actually, New York, New Jersey, and Massachusetts. I would love for us to continue broadening our horizons. But these are 12 young adults who have their own lived mental health experience that they've been so kind enough to share with me and share their experiences with each other during our meetings. And they all range between 18 to actually 32. We've had people who have been with us for about 6 or 7 years now, which has been a great retention rate for us. And we just actually added on 6 new people, which I'm super excited about. They have been a great asset to our youth advisory board. Some of the things that we do is that we meet once a month, and it's usually about a 2-hour meeting where we will have principal investigators come to us, research coordinators like myself, and they'll kind of just come talk about their project and in the ways that it relates to young adults and their mental health conditions. And what they do is they look at us as the experts with our own lived mental health experience and as youth and young adults to kind of answer the questions that they don't really know how to answer. So some of those things can be on surveys. It could be talking about the language that they include in their surveys. It could be whether their flyers look like something a youth or a young adult would look at. It can range from actually taking the surveys. It can do we can do brochures and kind of go through the language in there as well. And then they ask us some real questions about, do you think that youth would be interested in this? If not, why? What can we do to change it? How can we get them involved? And they really try and listen to all the things that we're saying. And one of the great examples that I have is actually, because I can't get Gina's presentation off my head, because smoking cessation did come to us and kind of ask some questions. One of the things that they really tuned in on was the fact that the original wording for one of the smoking cessation flyers was all about quitting smoking. And I will not forget this, but one of our young adults looked at us and said, well, smokers don't want to be told to quit. That's the biggest turnoff for them, is that they don't want to be told to quit. What we want to focus on instead is we want to talk about healthy choices and how we can make more health conscious choices and how we can work as a team to kind of, step it up to quitting, but not necessarily having to quit cold turkey or scaring people off. And as a previous smoker myself, I will say, yeah, absolutely. I didn't want to be told to quit smoking. I already know it's bad for me. My mom's told me that 1,000 times, of course. But being on the side of being a young adult and now being in research, I was like, wow, I never really put 2 and 2 together. So even as a young adult, I didn't have that perspective anymore because I was coming from a research lens. So that's been an incredible thing to see the way that these young adults work. And like I said, just them sharing their stories and being in an environment where they feel heard and they feel like they're making a real change. And I do go back to them and show them the changes that we've made. So I've shown them the changes that we've made to the flyers. I've brought the research results to them to be like, hey, this is really how we incorporated the things that you have talked about. And we really do focus on making it a very inclusive board. So one of the things that we asked during recruitment is to share their mental health experience with us and share some just basic demographic information. So right now we have about 7 women on the board and we have about 5 men. So we're trying to keep that at about a 50-50. And during recruitment, just because I co-facilitate it does not mean that I'm the one who's picking everybody. I am a cisgender white woman and I recognize that. So I try and be very conscious about those types of decisions. So I included 4 or 5 people from the center in order to be able to pick out a very strategic, inclusive, and diverse board for us to continue working with. I'm just looking at my notes to see if there's anything else that I might have missed. But one of our biggest projects with the Youth Advisory Board is that we do what we call a memes project, because I will admit, as a young adult, I do communicate through memes rather than words most of the time. So I will just send my friends memes, and that's how we communicate with each other. And one of the things that they came up with here at the center was that the communications team wanted young adults and other professionals to be looking at our social medias more, so our Facebook, our Twitter, our Instagram, all of that. And they thought that the Young Adult Advisory Board, so the YAB, would be very good at creating memes that were mental health based. So every 2 months, we actually get together and we have a really fun time making 4, 5, sometimes 6 memes together using a meme generator, and kind of like being like, oh, you know, it's taken us 100 years to find a mental health provider or a therapist. And so we have like a skeleton of us like waiting until we're basically dead to find a psychiatrist. And that's the type of humor that young adults use a lot lately. And so it's been really nice to be able to incorporate that. And then we obviously send it to the center and have like the communications team look it over and approve whether it's appropriate. But they've come up with some extremely funny ones. And it's really nice for them to then go to the page and be able to see their work, even if it's in just like a joking kind of way. But that is our Youth Advisory Board, and I'm happy to answer any other questions.
Well, thank you, Emily. It's wonderful how you've included the youth voice in research. They've been for so long overlooked, and you know, I'm excited to hear about the yabbies, and I think your idea of how to reframe the smoking cessation coming from the young adults is very interesting. So I commend you on the program you've been involved with. I wanted to just turn to questions, and then after we've had some questions, maybe summarize a little of the discussion and panel. And so we'll open it up to questions, which I think you can put in the Q&A.
I suppose to start off, I do have a question. When it comes to recruiting for these stakeholder groups, what is the best means of doing so? How do you get the most reach, the most amount of people involved?
Emily, do you want to talk a little bit about how you recruited for the GAB, and then I might be able to talk a little bit about the FAB, or we could talk about how the peers were recruited for MGH.
Absolutely. So actually right now I'm in the process of trying to change the way that we recruit people. I only came into this facilitation role in January, and before that, what we had generally done is we reached out to our networks through social media, through professors, through principal investigators, just really trying to use any means of communication that we could find, talking to friends to see if there were other friends who were interested. And what we would do is we would do just a call for like resumes and for cover letters to talk about why this young adult might think that they were eligible to be on the board, or why they were interested to be on the board. So normally just a resume and a cover letter. And two things that I tried to do when I got those resumes and cover letters was look for people who maybe hadn't had much professional experience, look for people who maybe had already been on a board, and try and find people who would really benefit from this opportunity rather than having somebody who's had multiple opportunities already kind of join us. Not to say that their perspective wouldn't be valued, it absolutely would be, but we really want to give it a chance for those who might not have the experience. So that's generally how we've been recruiting, is that we would make a flyer, like I said, put a call out through email, through text, through word of mouth. What I'm trying to do now is actually create an application, and this has come from research that I've been doing the past couple months with a different project, to see that there are other youth advisory boards and other just councils and boards in general that kind of use a standard application. So I'm in the works of doing a standard application, but I also still really like the idea of asking people for their resumes and cover letters. And then what we do after we've received them and kind of narrowed down the pool is we do a group interview, because nobody wants to go into an interview completely flustered and red-faced and heart racing. We don't want to do that to anybody. I totally get it. I've had to do it multiple times. But what we really like about the group interview is that we're able to see not only how that person is able to hold themselves, but we're also able to see how they collaborate with others. How do they talk to others? Are they able to do teamwork and collaboration? And from there, I'm a big thinker on the fact that you can't learn things without other people. You always have to be learning from other people. And so that's how I've been kind of structuring the YAB and how we recruit. But I hope that answers the question, and I'll turn it to Dee.
Emily. And do you want me to talk about how we recruit?
That would be great.
Okay. So as Emily was saying, the Youth Advisory Board, or YAB, is a national board. So they stretch their arms and their net wide. Our Family Advisory Board right now is much more local. It's Massachusetts based, but we use some similar methods to recruit. And then we have a flyer that we put out on iSPARC and Transitions ACR's social media, as well as in e-blasts that we do, and asking for folks who are interested. I don't know if anyone from the FAB is on right now, but I believe they're going through this process again this year because, boards change. People have to have the opportunity to come on and come off. So yes, so we use our social media, and then we also reach out to partners that we work with to share our flyers and information.
I can also say in recruiting for MGH, I was originally recruited because I was working with one of the co-founders, Darius Stasel, in residency training, and they brought me on early on in the rating of the grant. From there, we thought we would hire one peer as a principal investigator, and had difficulty finding that. And we met a lot of great candidates while interviewing for that position. And we decided instead of one person, we would hire 6 other peers with diversity and across the state. We did some job advertisements. We got, I think, one candidate through a job advertisement. We also did a lot of personal networking and talking to people. We were looking for people because we wanted some peer-led products with initiative and a little bit of an entrepreneurial skill. I had to personally ask people 2 or 3 times to apply. Sometimes they said no, and then I would come back to them and say, you really would like this. And then they finally applied, and we were able to get them. And we have a great team that we've had terrific retention at. We've had the same team pretty much for going on 4 years now. So retention is another, obviously, issue.
Anne gets big marks for persistence. And she definitely is a strong recruiter. She knows what she's looking for, and she doesn't take no for an answer very easily. So
That's for sure.
And therefore, there is a lot of group process that takes place in our work, and I think makes a big difference in terms of the breadth and depth of what we end up doing. I think that that's a fair way to put it. But definitely it makes a difference having a breadth of people who have different life experience. I think my colleagues would agree with that, would you not? I mean, that really adds to the incredible depth and breadth of what we do in terms of
We do have a question about what is being done to ensure LGBTQIA diversity in recruitment.
sure enough.
Dee or Emily, do you want to answer that? And then we'll go.
Roy, do you want to answer?
Sure. So to be inclusive with the LGBTQIA community, I will share that I am in the LGBTQIA community. So I do identify with them. But we also, one of the things that we do is we talk about pronouns a lot. And so as you can see right under my name, I have my pronouns listed. We do have a couple people who identify as they, them, she, her. So that's one of the ways that we are trying to be inclusive, but we're also trying to be inclusive again with the new application process that I've been talking about. So that would be a demographic question that I would be asking. And the one thing that I caveat that with is that we are not forcing anybody to share this information with us. It is not required. I'm very intentional and very specific when I ask these questions. And I do let them know that this information solely stays with me. It goes in a little Excel spreadsheet just in case we ever needed answers on demographic information about the YAB. But other than that, it is not shared with anybody. We do talk about at the end of our meetings, we do talk about anything that people would like to talk about. And so sometimes like at the end of this month, Pride Month stuff will come up and we will be talking about some Pride Month activities and whatnot. Because I love Pride Month, so go Pride Month. But yeah, so these are some of the ways that we try and be inclusive. And it's mainly about having an open dialogue and open communication. We try and be as transparent as possible. And I've really tried to instill that within the board and they've been super receptive to it. We allow them a lot of freedom to be able to come up with their own rules about how they want the board to run. We're constantly asking them about a comfort clause. And for those who might not know what a comfort clause is, it's basically the guidelines of how we like to run the meetings, what's appropriate and what's not appropriate, what type of language we should use, how we should talk about people with mental health conditions. And we give them a lot of power and a lot of say in that, because again, this is here to benefit them.
Thank you so much, Emily. I'm just noticing the time. And so I just want to thank everyone, Emily, Dee, Jackie, Valeria, and Cynthia. Beautiful job. We really, really appreciate your perspective.